This segment of DelmarvaLife is sponsored by TidalHealth.
We have spent a lot of time this February discussing the many aspects of heart health. Everything from spotting a heart attack to the kinds of exercise and diets you can utilize to prevent one. One component of heart health that might not be so obvious is its connection to your mental health.
Yes, studies have shown that patients who suffer from mental health conditions like anxiety and depression are more likely to develop a heart disease risk. And with us to explain more is Dr. Ahmed Abuhanya. He's with TidalHealth Cardiology. So good to have you in Historic Studio D this afternoon.
Thank you, Lisa. Thank you, Jimmy. Thank you for having me today.
These studies, tell us about these studies that make the connection.
So, in fact, this is a very important topic, and it had gained more traction in the last decade or two, I would say, with more awareness and better diagnostic tools to assess for mental health disorders. And there has been numerous studies actually linking depression and anxiety, even bipolar disorder, to increased risk of developing heart disease, including heart attacks or heart failure, or even dangerous arrhythmias, as much as like 3 to 5 times the general population. Same goes for bipolar disorder. Not only do they increase the risk, but they can make heart disease happen at a younger age. This actually prompted the American Heart Association to consider depression and bipolar disorder, namely, as intermediate conditions for the development of heart disease and early heart disease.
So you mentioned bipolar, you mentioned depression. Are there other mental conditions that could lead to heart?
Absolutely, and one actually particular example is PTSD, for example, or like anxiety disorders or stress disorders in general, but specifically PTSD, because it can be a risk factor and an outcome of heart disease. So if you think about it, PTSD by itself, or having like a stressful environment or stressful personality, can increase your risk of developing heart disease. But also it was found that in people who, for example, survived a heart attack, or people with advanced heart failure, they can actually develop PTSD as a result of just having that traumatic event throughout your life.
So you talk about heart disease. Are there specific cardiac complications that can happen because of mental?
So I'm going to use this actually to mention a very classical example, and it's like very overt and recognizable. This is a condition we refer to as Takotsubo, or stress-related heart dysfunction, also known to people as broken heart syndrome. And it's literally what the name says. This is in people who experience intense or immense psychological reactions, whether it's due to natural disasters, earthquakes, or even the loss of a beloved one. They can develop actually objective evidence of like dysfunction in the heart muscle. They can present with a similar clinical picture to people having an acute heart attack.
That's incredible. Okay, so what can we do to take action with a mental health stress cardiac event?
I think, first of all, awareness. We should completely eradicate the stigma around mental health disorders. It's not always in your head. It can be in your head and also affecting your body. Considering the person or the patient as a whole, instead of just focusing on the traditional risk factors that we deal with, like stop smoking, let's control your blood sugar, let's control your blood pressure. But also we need to also address the psychological aspect of the person, their social aspects. In fact, the American Heart Association now recommends depression screening as one of the preventive measures in addressing heart disease. Also, in people who, for example, deal with a diagnosis of heart failure, or they survive a heart attack, one very important component that I always recommend to my patients is cardiac rehabilitation, which involves both exercise training, but also some element of psychological well-being. The fact that you're there with other people who experience similar event to what you experience, you share what happened with you, you share your experiences, how you're dealing with your illness now, and that can have a very good impact on your recovery.
Wow.
And of course, TidalHealth offers all of those services.
Absolutely. In fact, our behavioral health center offers in-person and televisits for whatever mental health disorder you feel you need help with. And we do actually hold free mind and body therapy sessions once a month, and those are accessible to the public. They're for free, and they're mainly focused at improving resilience and dealing with stressors.
Well, I'll tell you what, we'll have a link on our website,
Absolutely.
DelmarvaLife.com, so folks can get all that information. Doctor, thank you so much for coming in.
Thank you so much for having me.
Thank you.